The UK had seen one of the biggest drops in immigration in the last 3 years because nearly less than 4 lakh people were granted a visa to study and work in the UK in the last year alone, that is in 2024. And if you watched my last video, you would know this, but in today's video, I am going to be sharing a silver lining with you because if you are somebody who's planning to come into the UK as a healthcare professional, then this video is going to give you some really good updates of what might potentially happen in the next few months in terms of NHS recruitment. So again, if you do not know me, my name is Nikita and I make videos about living in the UK as a healthcare professional, getting your registration and landing your dream jobs. And today's video is going to be decoding exactly how you can do that in the next few months and what is the NHS recruitment process going to look like, especially if you are planning to come to the UK. So without wasting any more time, let's get into the details. But before we do that, let me just remind you, if you haven't already followed me on Instagram and on YouTube, now's your turn to do so. My handle is Physiotherapy in UK. So let's get into the details. So again, before moving ahead, let me just remind you that if in case you are wondering where I've got all of this information from and what is my source, I will leave the link for the article right in the description below, so feel free to go and check it out. But I will be putting up screenshots throughout this video, so again, feel free to keep verifying it as and when it sort of comes along. But as you can see on your screens right there, it says that Keir Starmer's NHS plan is what are the key elements and how can it succeed. Now, the PM has promised that 92% of patients waiting for planned care in the NHS will once again be treated within 18 weeks. So that essentially means that obviously in the UK, we have a public healthcare system known as the NHS. And what essentially tends to happen is whenever you need an emergency care or, if, for example, you need a surgery that is planned, or you need care that is planned, you will be put on a waiting list, and based on your priority you will be seen by the desired or the sort of appropriate healthcare professional in the UK. Now this is what typically happens. So let's just see a little bit ahead what this article and the PM has said. So in Monday's big NHS speech, Keir Starmer promised that by spring 29, 92% of the patients waiting for planned care in England would once again be treated within 18 weeks, as they are meant to be already, but only 6 in 10 are actually seen. The elective reform plan will deliver on our promise to end backlogs, the Prime Minister vowed, as he set initiatives to fulfill a pledge that is a part of his plan for change. So what this is basically saying is that at the minute, a lot of people are not seen within the designated period of 18 weeks, and the Prime Minister, that is Keir Starmer, has now promised to change that by making sure that most of the people, so at least 92% of the people, are seen within that 18 weeks waiting period for any form of elective surgery. Now, one of the ways they're obviously planning to do that is by expanding the role of community diagnostic centres. A network of CDCs across England was announced in October 2021 to help improve waiting times following the huge disruption of care caused by COVID-19. These are meant to provide quicker access to X-rays and CTs and MRI scans and are to be in convenient locations such as shopping centres, thus improving earlier diagnosis of a disease and reducing the pressure on hospitals. Now, what this basically is saying is that there might be more chances of people getting X-rays and MRIs because they're opening more centers, but also they're trying to keep it in accessible locations. What this article further goes on to say is that innovative element of Starmer's plan is that 170 or so CDCs will open for 12 hours a day, 7 days a week, wherever possible, to expand on the number of tests done. So this right here is a clear indication that potentially there might be more lab openings for people who are planning to come into the UK. So this will include most likely people who are working in the laboratories, and that might mean that people who are coming as imaging technicians or as lab technicians will find greater job openings in the next few months, especially if more and more CDCs are going to be open. Now, moving on to some of the other updates or how they plan to do this is more operations are going to be done in surgical hubs. Again, these have existed for several years and more than hundreds have been opened. These specialist facilities typically perform common operations such as cataract and hip replacements. Under the elective reform plan, 14 more will open in hospitals by June and 3 others will be expanded, allowing for more surgery to take place and treatment to take place sooner. Now, again, what this is really promising is that there will be more and more surgeries happening, more of these elective surgeries such as cataract or hip replacements, which is really great, because what that essentially means is that there are going to be an increasing demand for nurses to be there in the OTs, or for physios to be there for the post-op rehab, or for occupational therapists to be there in order to sort of facilitate that rehab process. Now, this again is brilliant news, because considering the fact that obviously healthcare professionals are required for some of the key healthcare sort of demands that have been sort of promised to be fulfilled by the Prime Minister, there might be an increased demand in the healthcare staff. However, what this article goes to say is that NHS shortages could make it extra hard for the CDCs and the surgical hubs between them to deliver an extra 500,000 appointments a year in the new plan. Where are the staff going to come from? The NHS still has about 1 lakh vacancies. That is not a small number, guys. 1 lakh vacancies is huge. And the government have talked a lot about their ambitions for these two types of facilities, but have not said exactly who will staff them. Now, again, this is again a question that is put out there for a lot of people to deal with, but also what that means is that right now in the UK, there are still 1 lakh unfilled vacancies existing. Now, if you are a healthcare professional planning to land a role in the UK, you've got to remember that if you come under the HCPC, you need to have the license to practice from HCPC to be even considered for roles in the UK. But again, in order to be considered for roles in the UK, you need to have really strong job applications. And if any of this is of concern to you and you're not landing interviews, or you're struggling with your HCPC application, feel free to reach out to me and book a one-to-one session with me. I'll leave the link for that again in the description below. So don't hesitate to reach out to me if you have any concerns and would like to have a chat with me about your particular situation. So now that we've covered all that the government is planning to accomplish in the next sort of 5 years as its long-term sort of plan for the NHS, let's talk about how is this going to impact you. So what is the future impact for NHS recruitment? Now, as you are all aware, in the recent times, there has been a severe decline in the number of visas being issued. Obviously, the health and care worker visas considered alone were only issued up to 63,000 in the last year. And that came as a huge drop as compared to almost 4 to 5 lakhs in the year before that. Now, I am not surprised personally, because obviously the major chunk of visa applications under the health and care worker route was mainly from the carer side and not so much from the healthcare professional side. But within the UK right now, there is a growing animosity against the immigrant population, especially because there is a lot of illegal immigration in the UK. But also, I think what a lot of people are realizing here is that they are not really against healthcare staff, or they're not really against people who are coming legally to work in the UK, because that helps to provide quality of care within the NHS to all, but also it helps to boost the economy and find ways to make UK more productive. And this has meant that obviously there might have been a bit of a shift in that thinking of the people who are present in the UK at the minute. But what that also goes on to say is that if you are considering to come to the UK as a healthcare professional or secure a sponsored job within the NHS in the UK in the next few months or in the next few years, then this might be the right time. This might be the right opportunity for you to land those roles, because as you can see, there are still over 100,000 vacancies. And if the plans of what they have suggested today in this article were to come into fruition, or were to get completed over the next few years, that number of vacancies is only gonna keep steadily going up. And what that means is that you are going to have higher chances of landing those roles, because there are just going to be more job openings being posted on NHS jobs websites, or the Track website, or the NHS Scotland website, and you've got to make the most of that opportunity for yourself. Again, if you have questions related to this, do drop them down in the comments and I will try to get back to them. Take care, guys. Bye.